Welcome back to This is Healthcare in America, a series created to share more about the inner workings of healthcare today and why the current system is simply not working. I'm Reid Zeising, founder and CEO of Cherokee Legal Holdings. Today, I'd like to talk about insurance defense and how they target and attack doctors who serve patients on letters of protection, or LOPs. So let's get to it. Insurance defense counsels have made doctors holding patient liens their number one target. They literally call them litigation-funded doctors. Think about how ridiculous that is. The overriding premise seems to be that somehow patients and plaintiffs who have been injured through no fault of their own and are also uninsured do not deserve access to quality health care? This is just plain wrong. Insurance defense starts with the inaccurate assumption that a doctor's medical opinion is biased if they're seeing a patient on lien. They call expert billing witnesses, including forensic accounting experts with experience in the medical field. They look to identify overbilling, upcoding, double billing, unbundling if they can. And they try and get their hands on reports in advance of a 30B6 corporate deposition. These litigation-funded doctors, when they can't get what they want, they then try and get to a billing supervisor. The corporate deposition is typically where the treating physician will claim they have no knowledge of billing practices, good or bad. And here's where insurance defense counsel quite literally try to trap people into fraudulent agreement. Anyone with billing authority agreeing that overbilling is fraud. Well, that's a true statement. They then look for any billing discrepancy to run then to the far-drawn conclusion that the healthcare provider agrees that somehow what they've done is fraudulent. Insurance defense counsel find these discovery battles are worth the trouble, and their thoughts include: these motions to compel are expensive necessities, that they will able to get litigation-funded doctors to disgorge secret files, that litigation-funded doctors have been getting away with discovery abuse because they know defense costs and therefore are abusing the system, that cracking one doctor will lead to more because they somehow share secret files. I'm not disputing that there are bad actors out there, but I don't see patients wanting to get spinal surgery that's not needed. Patients want to get healthy using as few knives as possible. In the eyes of insurance defense counsel, the litigation funding treatment model looks something like this. First, there's the litigation funding, or private investors, who provide money to medical providers. Doctors borrow from these investors to cover their overhead in order to treat patients on a volume model. Physician liaisons then market to lawyers and medical providers and practices in order to gather patients with claims. Lawyers refer patients while secretly consulting on the treatment of their clients by providing case status updates. Doctors from there then supposedly inflate bills, overtreat, and overbill patients on letter of protection, all of which results in the doctors making more money by overtreating patients. This simply isn't the case. But even if it were, this is where technology, usual and customary charges, kept track by platforms like gain servicing, become critical. The gain servicing platform creates a separation of church and state, so to speak. It's an independent servicing platform designed to streamline, ease, and automate the treatment of personal injury victims on letters of protection. That's good for both small and large practices. The information gathered and analyzed is not shared with the doctor. It's used to estimate the probability of collections and to negotiate reimbursement rates on behalf of healthcare providers, while allowing the provider to maintain their independence. Small practices who treat personal injury victims can be more at risk for a doctor to have access to case information without gain servicing. hence the need and benefit of utilizing a third-party, AI-enhanced servicing platform. One of the biggest objections we've come up against by small practices is their concern for losing their relationships with attorneys. But the goal of Gain Servicing, a nationwide platform, is longevity, and referral sources are the key to its success. Increases in collections are not found by demanding more money than a case can handle. It's found by not missing dropped cases or perhaps attempts by patients to settle directly to insurance companies and not pay outstanding bills. For large healthcare providers, it's equally as important. The sheer volume of receivables and the losses they incur without sufficient case updates can seriously affect their collections. In addition, there's no reason for a large provider to spend millions of dollars building out these systems when working with Gain can be done on a variable cost basis. There is not a more efficient or accurate way to handle all of the activity surrounding treatment on a letter of protection than through platforms like the Gain Servicing portal. The industry is changing, and Gain Servicing's leading that charge. Think of the traditional funding businesses as either physical film or video rentals. The rise and fall of great brands, Kodak and Blockbuster come to mind, both met their demise because of the lack of vision and technology adaptation. Kodak developed digital film, yet chose to hold on to the cash flows from physical film until it was too late. Blockbuster was approached by Netflix to buy them, and yet said no. In the funding industry, it's time for this type of change and technology to permeate the entire space. Not only is it good for our industry, the funding industry, but it's also good for attorneys and medical providers serving personal injury patients. Success is simple: evolve or get left behind. We're ready to make the practice of serving personal injury plaintiffs, whether that be for the attorney or medical provider, better. Are you? That's it for today's episode of This is Healthcare in America. Until next time, please stay out of the hospital.